Good morning and welcome. Thank you for attending this Connect and Learn session organised by Boost, which is the North East and North Cumbria Learning and Improvement Community. My name is Ashley Eaton and I am from Boost, and today we are joined by Mark Smith, who is Director of Public Service Reform for Gateshead Council and is also the Senior Responsible Officer for Changing Futures Northumbria. And Mark's going to be presenting for us today relational working and the liberated method. So Mark's presentation is going to set out how rebuilding services and support around what matters to people rather than services creates those better outcomes and uses fewer resources. And this work is what has culminated in the liberated method. And it's been developed over the last 5 years in Gateshead and more recently across Northumbria as well. So these Connect and Learn sessions are designed to be a series of online learning events planned with the purpose of sharing and spreading improvement work across the North East and North Cumbria health and care system. Each session will have a different focus. So the Connect and Learn sessions are designed to be more than information sharing, but they're also an opportunity for you to connect with other like-minded colleagues around a specific topic, to generate ideas and take forward improvements in your own work, team or service as well. So before we kick off, just some very quick protocols. If you could keep yourself muted when not speaking, that would be much appreciated. Post any questions that you have in the chat, and we'll also make sure there's time for questions at the end. Please listen with respect and be present. Share the learning, that's really important for us in Boost, and spread the word about these sessions as well. And please be aware that we are recording the session as well. I will post a link for you guys to be able to give us feedback in the chat. So if you're able to complete that, that would be much appreciated. It's short, just a few questions. That would be fantastic. So I will now hand over to Mark.
Good morning, everybody. Thank you, Ashley. Can you hear me okay? Can someone just give me a wave? Because I've got a bit of a temperamental iPad. Okay, lovely. Thank you. So, yeah, thanks for the introduction, Ashley. So, thanks for the opportunity to present. So, as Ashley said, I'm Mark Smith. And I won't read out my job titles again. But essentially, what I'm going to present today is some learning from a piece of work that we're doing called Changing Futures Northumbria. So that is a government funded, so it's funded by DLUC and the National Lottery. It's a 4-year project, just over £5 million worth of funding. And its role is to essentially rebuild the approach to working with adults who have multiple and complex needs, who thus far have not been well served by the existing system. And that's not people haven't done their jobs well. It's more about the design of the work and the interrelationship between those people with different skills. So what we've done over the recent years, but has culminated in this work, is essentially develop something we call the Liberated method, which is based upon building relationships rather than deploying specialisms. We need specialisms, but we need to also have context. And one of the things that austerity has done is it's essentially driven an efficiency agenda which has taken context away, and that's actually been counterproductive, as we're about to see. So I want to talk a bit about where I think we're up to as a system of health and well-being. That's local authorities, obviously the NHS, the criminal justice system, the whole works. Some evidence as to why I think we're there, what an alternative looks like, why we think that's the way to go, and some stuff around why that's going to be difficult to make normal. So I'm just going to start with a bit of a trigger warning, because I'm about to describe somebody's history with their consent in terms of their interactions with services. So those of you that either have yourself or have people close to you that have had a very frustrating time interacting with multiple services, this would probably trigger something in you. So I just wanted to put that out there. What you're looking at is a very small section of somebody's history that we have basically assembled from using their narrative. So we're working with adults with multiple and complex needs, and we're working with them in 4 different settings: homelessness, alcohol addiction, women's services, and A&E. And what we're doing is that we're working with people in a very different way. And we're also trying to understand their past. So they've told us their story. And with their consent, we've gone to all the places they've interacted with, and we've got data on those interactions. Now, that's taken 14 data sharing agreements. That has not been easy, but we've got the data. And what we've been able to do is put it all together and tell their story as a series of transactions and cost it. Because that's important. If you're creating a case for change, you need to be able to articulate the current. And nobody can. It's really hard work. So we've gone out of our way to do that. So what you can see on that slide, I'll take my glasses off, is a load of ambulance call outs, presentations at A&E, all sorts of bits and bobs in there. And any one of those orange boxes would be an event for us, I would argue, just one of them or two of them. And this is a small section of somebody's life. And this is a different section of the same narrative. So this time we've got more presentations and some admissions and procedures. I'm getting in close because I'm getting old and my eyes can't go very well. And here's a different section, again, more A&E attendances, more admissions and more procedures. This is a different, there's no overlap. This is a completely different section. And here's some mental health presentations and treatments and transfers. And here's some more. And here's some criminal justice activities, so arrests, incarceration, police custody, prison custody, attendance at court. And here's some more arrests and some more procedures. And here's some more. This is the same person. More police custody, drunken disorderly, breach of an ASBO. So you can tell that this person's getting all sorts of things chucked at them. And here's a bit more. This, you get the idea. Those lines, by the way, are connections. So no incident happens in isolation. So where things happen, like a court appearance might follow an offence, which might in turn follow something else, we connect it all up. This has been a major piece of work. Here's some more court proceedings. Here's what's this? Adult room concerns and adult social care input. And if you zoom out, that's kind of what it looks like. That big clump on the left is a compression of 9 years worth of history for this one individual. And the swim lanes are, the top one is the health system, then you've got the criminal justice system, you've got housing, social care, mental health, and some other ancillary things at the bottom. All of that is one person. We got involved. If you look at the very top, you'll see a row of kind of more pale coloured boxes. That's us, and that's the last year. And what happened there is lots of bespoke interventions and work partnership working with we'll call him John. And what we found is that the need for services just fell away. We did need them. There are some things in that white space, but there's a lot of space. And I'm going to talk today about what happened and why, what it means. So just to demonstrate that John's interactions year on year were going up and his life was getting worse. So John struggles with alcohol. He struggles with low self-confidence. He struggles with all sorts of illnesses. And he's essentially had a lot of time in the criminal justice system as well. But he's bounced around from service to service to service. When we added it all together, there were nearly 3,500 different interactions across those services, 3,500 opportunities to actually understand or try and get to know John. What we tended to do was assess him, but we never really understood him. That's a collective. 1,000 of those interactions were in the health system, and he was used to be the #1 attender at A&E at the Queen Elizabeth Hospital in Gateshead. Just as a side note, when we started working with John, he was their #1 attender. He wasn't their #1 attender. And when we spoke to the QE about him, they thought he died because that's the only way you get off the frequent attenders list. And no, that's not what happened. 1,000 criminal justice and police interactions, 500 nights in support accommodation. But throughout all of that consumption, his life was getting worse. So none of it was really helping. And we added it up. And as a minimum, because we haven't got probation's data yet, £2 million on one individual. And yet the amount of effort we put in to screen people so they don't have access to relatively minor things is astonishing. So there's 2 million quid we've spent collectively as a system to make somebody's life no better and a bit worse. And every single one of those things on that left-hand clump will be inspection friendly, it'll be compliant as per the system. It's the nature of the design of the work. It's not about people doing a bad job, it's about the system disabling the ability to do a better one. And we want to be honest about that. So that's what we've learned when we dug his history up, and we've done it with other clients that we're working with, and it's pretty similar. 1.5 million or 1.2 million or 0.9 million. We've got a range of values. John was the first person whose history that we dug up, and we got to, well, it will be over 2 million. We worked bespoke with John. So what we've done is we've given him his own caseworker who is not a specialist. And what we've had, when that specialist who has lived experience has got to know John and has worked with him on the little things that, so we don't ask what do you want, we ask what matters. What does a good life for you look like? And that splits into what matters right now and what matters ultimately. So when someone's in a real hole, what matters right now is I'm scared, I'm skint, I'm hungry, and I need a drink. And what matters ultimately is I'm lonely, I've got no connection, I'm, etc. And I would like a bunch of things that I don't have, and he's got a lot about him as John. So by learning those things and acting on them and pulling on specialisms when we need them, and we'll come on to the difference between pulling and referring in a moment, what we've done is we've had 161 interactions with him in a year. He's in the 6 months previous to us getting involved, he was at A&E 116 times, and in the following year, 7 times, and not a single admission. He's in recovery. He's building a community around himself. He has agency. His consumption of our resources is falling, and his welfare is improving. We've spent around £70,000 and a lot of time, mostly on accommodation. That could have been cheaper because there's issues in the housing system, but we've had to circumvent. But nonetheless, we have seen a big change. We've had brilliant pull from specialists when we've needed it, but what we have is context, and context is a massive, massive lever for helping people that, for whatever reason, struggle to be helped. But it would be remiss of me to describe John as a series of interactions over a period of years that cost £2 million. John's soulful, he's deep, he's a thinker, he's a troubled soul, or at least he has been. And what he likes to do is he just likes to write down how he feels. So we just gave him loads of cards, and because he likes writing on cards. So his caseworker just went out and bought him a load of cards and said, here you go. And what he does is he just writes and he gives them to the team, and he just express, and it's part of his recovery journey. And so he's attending AA and he's doing brilliantly. So what's going on? So when we study John's history and people like John, and we've studied a lot of people like John, but I'm using him as an example. What we find is, well, let's say you've got 2 problems, right? You've got 2 problems that require input from 2 specialists. So what you can do is you can either present to each of them. So those green lines are presentations. So if you present to specialist 1, there'll be some eligibility criteria you may need to get through. And then you present to the other one. And, that's a way of dealing. You might have a housing issue and a benefits issue. You might have an illness, or whatever it might be, 2 things. Or you could present to one and be referred by the first one to the second one, which is the dotted black line. And that can happen in either direction, and there'll be an eligibility criteria built into that. That's the system broadly. So if you and I have 2 things going on, there are 3 different routes to get those things addressed by a specialist. So imagine if you've got a bunch of other things going on. So you need a bit more help. So you could either present to them all, or you could present to some and be referred to others. Now, I like to think that I'm not unintelligent, but I think I would struggle to manage all of that. And the critical thing is, this configuration assumes that the answer to my problem is some combination of input from all those specialists. If I can get the right combination in the right way, I'll be okay. But what we're finding is that often there is a specific unmet need that isn't covered by specialism. It's probably a generalism thing. It might well be that I need to express myself in a certain way. John plays the guitar. We've had other people that dog grooming is the answer, or carpentry. But if we can treat the system as an assemblage of specialisms, we miss context. And then what happens is we miss the opportunity to build. So what we've done instead is we've moved away from the desired thing to navigate. Let's put a navigator in there. That'll help navigate those specialisms and everything will be better. It might be better, but it won't be best. What we do instead is we give each person a caseworker who has a low caseload, who is not a specialist. But their job is to work in partnership with the person they're helping. And what they'll do is they'll create context. What matters? What matters to me? What does good look like for me? How much of that am I aware of? And we'll work, if you only know one thing, we'll work on that until the second thing becomes work on that. And what we learn is there's a whole bunch of things have come up which do not require specialist support. It's a bespoke by default approach. So we're configuring. But that's not to say we don't need specialists. Of course we do. And we pull them, but we do it with context. And then when I showed you that diagram before of the swim lanes and all the space on the right-hand side, and they did have specialist input, every single one of those specialist input was pooled and it was a value. There was no waste in there. And the specialist was saying to us, do you know what? By you having context, I can make a better decision. So I'm not worried so much about eligibility because I think I can help you. And what we found is that the amount of waste went down and the efficacy went up. So this is contingent on people that are struggling having their own caseworker. So one of the refrains that I get is, but that's unaffordable. Just think of the left-hand side of that diagram again and ask me what's affordable. So this requires a relationship. Anybody who hasn't read Radical Help by Hilary Cotton, I would suggest you read it because it builds beautifully on this idea. So the liberated method, it's called the liberated method because staff found it liberating. I didn't call it that. It's not laissez-faire. There are rules and there are principles, but it is very much something that we think will accompany and supplement and bolster the offer that is currently available. This is not about rubbishing anything. It's about replacing something that I think as a sector we've lost. So there are two rules, only two. Don't break the law and don't do any harm. And you can pretty much do anything else. But there are some principles to guide. So this is what the caseworkers work to. Imagine that we built a system that's based on relationships rather than services. This is the territory you get into. So we have 5 principles. The first is we seek to understand rather than assess. And we ask what matters. See, an assessment is for us, not for them. An assessment typically asks, essentially, how much of what we do can we do to you? Or how much of what we have can we give to you? Or, perhaps more pervasively, what excuses have we got for saying no to you? The system defaults to no. Its default answer is no. You have to demonstrate the reason for a yes. There are a few exceptions, but not many. The scope of the work is not set by anything other than the relationship between the citizen and the worker, which is why carpentry, dog grooming, and guitars start to appear. We had one guy, homeless guy, and his first issue was his teeth. He didn't want housing. He had a gap here. And every morning he put his tongue through the gap, felt miserable, reached for the bottle. If you can sort my teeth out, I might have a chance. So the first thing we did is sort his teeth out. That we didn't shove him in because that was our sensibilities. We must house you. The question was what matters, and what mattered to him was his teeth. Then we worked on other things over time. We don't refer if we can possibly help it, but if we do, we hold the case. We don't. A referral often means it goes off my desk and onto somebody else's, but not here. What we'd like to do is pull specialist input in. We value it. We need it. It's important. But if we can't pull for help because people are busy, we have to do a referral. we hold the case still, we go with it, which is why these are principles rather than rules, because we know we can't always pull. We have to, sometimes we have to refer and hold. We make the decisions in the work. So I don't make any decisions about operations at all. What would I know? I don't have context. Context is king. And what we do is we say to the team, if you want to buy a coffee, give them a bus pass, buy a coat, get some food in because the benefits aren't through yet and they're starving and he's going to go out robbing if we just, things like that. If you've got context and you have the team have a running budget and they all have a credit card and we give them permission to spend it on whatever they want. And I can see the auditors, if there are any, shivering. Nobody has yet gone to Antigua. We're all right. But we do a mnemonic of plan, which is proportionate, legal, auditable, and necessary. So we get every receipt, we scan it in, we analyse it, not for scrutiny, but to learn. Because one of the things we're finding is if we're continually buying something, then if that's predictable, we can sort of do a scale piece on it and see if we can get it cheaper. So we analyse that spend. But it also, it does throw up the opportunity to challenge, but also to learn. So people know that it's going in the ledger, but they have total permission to do whatever they need to do based on do no harm, stay legal, and the other principles. Decisions are made in the work. And the final principle is that we don't set any arbitrary timescales. No assessment within 6 weeks or assessment within 45 days or whatever. Because essentially, as soon as you put an arbitrary timescale in, you're constraining the method. And this method is not to be constrained because we're trying to build it around people. And what we're trying to do essentially is move away from these things. So we don't want target times. We're not going to drop as soon as we refer. We're not going to have a decision made up in the hierarchy about something in operations, because all that does is it means the person on the front line will create the story they think the management want to hear, rather than when we start to move away from reality, we game the system. We don't want this or nothing when it comes to scope. The scope has to be as varied as the person. If we can't absorb variety, we're not really doing public service. And like I say, an assessment is a different logic and a different mindset to understanding. So that's the core of the liberated method, and that's what we're experimenting with. I'm going to skip this slide a little bit because it's got too much. I'm going to move on. So what I want to show you here is zooming in to the top row of what we did with John. So I know it's still quite small, but it's very bespoke. So it'll be things like, and not just with John, with all sorts of people, if John has an appointment at a clinic and he's nervous about it, we'll go with him. Because if he doesn't turn up for that appointment, we've got context and we know it's just going to set him back. Or if John has got no food and his benefits aren't due, we'll get him a shop. We're not going to get him a shop every day, and we're not looking to build an unhealthy dependency. But when someone's got no one or nothing, it isn't unreasonable to have somebody you can depend on. The difference between I can depend on you and I'm dependent on you. We're very careful about how we manage that. So these are the sorts of things that we do, and the slides will be available so you can look at it in more detail, but it's different. Now, we're finding these differences to be really quite telling. One of the things that we're getting, a number of adverse reactions from the rest of the system. We get some really great reactions, but sometimes we'll get people saying things like, you can't do that, you're not qualified. Or, we spent years working with them, you'll undo all our good work. What we're really hearing is, that will make us look bad if you succeed. So we've had a different person who we've been working with who's really, I don't want to say too much, has had some very difficult times and has been abused and offended against, and in a setting that is unsafe, but the system has deemed it safe. It isn't safe because she tells us it isn't, and that's enough for us. So when we said, okay, well, we'll move you then, we've already seen within 2 weeks that she's not self-harming anymore and she's sleeping at night. We are by no means out of the woods, but there is the change, and the reaction from the system has been very negative. Like, you can't do that. Who the hell are you? One of my team was called a plastic social worker. The notion of defending the professional boundary and nominally describing it as we're here for people. It's a we know best culture. We need to think differently about that. There's skills to offer. There's good intent, but when you actually work differently, it can create adverse reactions. So I'm not going to hide from that. I'm not going to pretend what we're doing is easy. One of the things that we've done is that those sorts of reactions have led to us asking the question, why is it difficult to do what feels so intuitively helpful? Because you look at that liberated method and none of it's new. This stuff's as old as time. Building relationships is as old as time. So what we did is we've gone back through that complicated history, and we've done it for all of our cases, and we've created an amalgam, a series of logic loops. So for example, somebody turns up at Gateshead and as homeless, one of the questions that we'll ask them is, do you have any local connection? One of the responses we've had from some of our people has been, well, no, I'm fleeing from somewhere where I do have local connection because I'm not safe there. The system response is, well, if you've got no local connection, we have no duty to help you. So sorry, off you go. Notice that we have no duty is a different phrase than you don't need help. Clearly you do need help, but I'm not helping you. So we've got to ask ourselves why. Why do people that get into public service do that every day? Not because they're bad, okay? And I'm not judging them. Sounds a bit like I am, but I'm not. We needed to understand what was driving it. And what this slide does, and again, you can look at it in detail, is it takes those decisions and it works backwards. So if you take the homelessness one, it works back. Well, why would we say that? Well, we're trying to comply. Well, why are we trying to comply? I need to demonstrate a prudent use of resources. Well, why would I want to do that if this person needs help? Because they're probably going to go out and offend and do all sorts of stuff if we don't help them. Well, because it covers my backside and I'm sticking to my brief. Why would we do that? And it all comes back, all of those different decisions come back to the red thing at the top. So the de facto purpose, the unintended but actual purpose of public services is to create and maintain a defensible position. You can trace anything back to it. And we didn't start with that hypothesis, we ended up with it by studying the data, studying the narratives. So there's scale solutions in there, there's assess, plan, do, assess, do, refer cycles, there's managing risk rather than need, so what if seems to be a lot more important than what is. And all of this stuff is pervasive in the system. It's born out of a desire for us to be efficient and a desire for us to be compliant. And that takes away a desire to be effective because we can defend not being effective. And that's what happens. That's why we turn people away that need help. So we need to tackle that. So some examples. So risk tends to trump need. I know you need that, but I'm worried about this. Therefore, this will trump that, and we're not helping you. You might upset the rest of the people in the street if I put you in that house. To which we would say, but we're providing them with loads of support, and they've been brilliant. They've made loads of progress. Well, 20 years ago, you trashed one of our flats, so no, we're not having any. Things like that. Assess, do, refer. The cycle of assess, do, refer. I'll do my bit and pass you on. I'll do my bit and pass you on. I'll do my bit and pass you on. With John, we counted something like 2,500 cycles of assess, do, refer. No one's holding the ring on John. And consequently, it just consumes. And what we tend to do when we see all of this consumption and rise in demand is we want to make it better. But what we tend to work on is efficiency. Let's do things better as opposed to do better things. And that just ties us down tighter into the wrong place. So the way we do improvement, as well as the way we do work, needs to change. And again, we focus on efficiency. So when you focus on efficiency, Albert Maysles' great quote about tyranny is the deliberate removal of nuance, and he's dead right. Because what you end up with when you take nuance away is you end up with something very autocratic and very transactional, a fixation on deploying skills and capability. And we lose context. They're very early victims of that. And that context is often the answer, or at least the answer lies associated with it. And as I said earlier on, the system defaults to no. Very rarely does it default to yes. It only tends to resort to yes if the stakes of inaction, for me, start to override the stakes of action. Then I'll act, but only then. So what we try to do is manage demand rather than service it. And the way we manage demand is we screen it out. And if demand gets too high, we'll move the bar up, the eligibility bar up. And we think that's a brake, but it's actually an accelerator, because what happens is the degree of acuity that finds its way into the system is generally higher, which is why you've got the problems that we've got in A&E, in various other places actually. Well, not so much A&E actually, because it doesn't have the eligibility, but there are in adult social care. In the old-fashioned world, when we had fair access to care and it went critical, substantial, moderate and low, and the bar was between substantial and moderate, and we moved it up because we were struggling with demand. Demand went up, not down. And I've done research that bears that out. So we have an issue around the way we use eligibility. Sometimes we have no choice, it seems, but there's a broader problem which leads us to that course of action. We need to think about what's going on there. So this is again, I won't go through it in detail, but this is our logic loops. When we look at what we did, what were the pervasive things? And what we had at the top, instead of create and maintain a defensible position, was help me to thrive. That's why I'm here. So it's written from the point of view of the member of the public. Some features of that is that when the teams do this work, we build learning in, so we iterate, and it's connected to the leadership. So if something's not working or not working well, we're iterating. We're not. What the current system tends to do is defend. Well, we did that because of this. We'll justify an attribute. The problem's them over there. We did our bit. But what we're not having that, so we're trying to iterate. And we start with people rather than services, and brings nuance back in. One of my sort of throwaway phrases, I guess, is if you start with services, you end up with services. But if you start with people, you tend to end up with solutions. So we need to think about our frame of reference for problem solving. And by understanding rather than assessing, the range of solutions that we come up with, it becomes a lot broader, but it doesn't become unpragmatic. So carpentry for Craig was a belting idea, and building his recovery around that has meant specialist input has not been wasted. The specialists love it, and so do we. By blending rules, so we don't just have rules. If you'll notice, we have 2 rules and 5 principles. Principles are great because they guide the work, but they don't tie you down. But rules are necessary if there is no wiggle room, and there's clearly no wiggle room. Do no harm or stay legal. That's not negotiable. But if you get in a habit of blending rules and principles, you can essentially absorb variety. And if anything varies, it's people. So that's a bunch of stuff. I'm near the end now, you'll be pleased to know. So we've got a couple more years to go. We're building more evidence. And one of the things that we're learning is that you can't just sort this out in operations. There is a system stalemate here. I'll just give you a quick example. So let's say adult social care, biggest budget in a local authority, they decide, even though we're skin and demand's going up, we're going to invest a load in prevention that's way ahead of our eligibility criteria. We don't need to act until here, but we're going to act up here. Now, I'm not talking about early help, which is a bit before. I'm talking way up, determinants of health and all that kind of stuff. Let's say they do that. And by doing that, they prevent loads of demand hitting the system. The chief beneficiaries from that are not social care, it's the health system and also the criminal justice system. And do you think for a minute that any savings that investment that adult social care put in will magically find its way out of the health system into the social care system so it can continue that it can recoup and it can build collectively? The answer is absolutely not. The money does not move the way it needs to. So it creates a stalemate, because it then becomes in no one's interest to blink first around investing in prevention. No, why would you do it if you're not going to see the benefit? It's like, one of those puzzles. It's like a load of tiles that slide around to make an image, and there's one missing, so you can move the tiles around. Imagine one of those, but there isn't a missing tile. All the ingredients are there, but they're all configured, and no one can move anything. That's what it's like. That's the financial stalemate. So in order to solve that puzzle, you need some force to break it up and put it all back together again. Force is probably the wrong word, because it needs to be a bit more benevolent and method driven. So what we're proposing in the Northeast in particular, we've got devolution next year. And with that comes a radical prevention fund that's been written into the deal. We think we need to invest in improvement and prevention and reform. So an institute that does that creates capacity and capability, means that nobody has to blink first. So we're doing a piece of work with CNTW, Mental Health Trust, based on this idea. what we're going to do is run a liberated method experiment with a whole bunch of people that are regularly turning up to CNTW or that are stuck in beds. But we're going to deploy context as well as clinical input in partnership using the liberated method to see what happens, so that the non-clinician and the clinician have equal footing. So we're getting rid of an unhealthy power dynamic, but we're sticking to the rules and principles. If we can demonstrate efficacy by doing that and unlock loads of demand, then we can demonstrate that this approach needs to be something we work on together, and the idea of an institute can deal with that. Demand does go up before it goes down, so we need to be able to absorb that, so we need some resources. Because if you start saying yes when you're previously saying no, you're going to have more to do. But when you do those things, all the demand for loads of the demand falls away. And you saw that in John's image. I'm not going to go on to that one. That's the design of the institute, but that's probably too much. So I'll just end it there. I think we get fan mail. I mean, not many public services get fan mail, but we've had some lovely cards from people who, have been in desperate situations and still are. I mean, it takes a while, but what we've given is hope, and we've created the ability for people to access their own intrinsic ability to thrive, so that we can step away at the right point. And to my mind, that's really, really powerful. So I hope that's been thought-provoking. I hope there's plenty of provocation there as well, because it's important to get these things out. And that's it. So I'll stop presenting now. So thank you.
Thank you so much, Mark. Absolutely fascinating. Such a different way to think about, yeah, how we run our services. Yeah, also, like you said, so simple as well. It's just sort of going back to, as you said, the building those relationships. Does anybody have any questions for Mark at all? Please feel free to come off mute. Oh, lovely, Simon.
Oh, hi, Mark. I'm Simon Douglas. I'm Director of Research and Innovation at CNTW. So
Hi, Simon.
I'm sure we'll be working together at some point soon. I only came across your work last week, actually, and it's absolutely fascinating. I'm really, really interested in it. I guess my question is around this. I mean, you talked about how difficult it was to kind of shift the system away from kind of, last resort to prevention, which is a hugely different way of doing things. Yeah. And we had this debate fairly recently with a colleague from Northumbria, Matthew Johnson, in the context of universal basic income, which is kind of similar sort of premise. Really interesting stuff, where you go as far upstream as possible, but it actually does eventually have an effect. I suppose we all hoped the ICB would start to help us view things in a more system-focused way, and that would help some of this. I'm just interested in how you kind of go about sort of really making the case around prevention instead of kind of just being stuck in the model that we're in at the moment.
I think being honest about the current and being articulate about the current state of play is key. Changing Futures is funded ultimately through through DLUC, and what I'm worried about is that if we'd have not done the work by digging up, we call it the burning platform work, the work that demonstrates that £2 million worth of consumption for John and the various other stuff. If we hadn't have done that, and we'd have done the liberated method and achieved better outcomes, the frame of reference for comparison would have been some evidence around our work versus whatever state the minister thinks the system's in. And I didn't want to give the minister that privilege. What I wanted to do is say, no, here's some hard facts about just how broken it is and what it's doing to the people in it, not just the citizens, but the people doing the work, because it's dispiriting. People don't come to work to say no when it's clear that what's needed is a yes. They get driven into it and it becomes difficult. So that burning platform work is critical for us. It's to take the subjectivity out of the current state of play and to redefine what we mean by affordable in terms of the future way of going. The other thing is to be honest about how far through the looking glass we are as a sector, because we can't probably do this whilst keeping the shop open with the current resource base. Money is tight, but if we're going to reform, we've got to invest in reform. So we need to put resources in place, but do it really smartly. To that point at the end about when you start saying yes, when you previously saying no, demand does initially go up. So we need to be ready for that. But if we're deploying a method that is relational, then the demand will fall away, and there has to be a collective to break that stalemate. Whereas at the ICB, local authorities, the devolved, the mayoral authority, criminal justice system, voluntary sector, everyone, there needs to be some fluidity, and it's not there. And nobody in the country has got this. And I think the Northeast is the kind of place that could do it first. That's my take. I just think there's a sense up here. I'm not always, as you can tell, I'm not from the Northeast, but I've been up here 8 years, and I get a sense of there's far less tolerance. I'm going to swear it. There's far less tolerance for bullshit over here than there is in parts of the country I've worked, and I'm really picking that up. So I do think there is something about taking very seriously the use of data to describe where we're up to, what's going on. Really being clear about the driver, so that create and maintain a defensible position thing that we can demonstrate through data is really hard to hear when it's you doing it. But I think if we can do that, then it just frees us up to have a better conversation about what to do and how to invest in prevention. The other thing I would say, just to add to that point, Simon, is we can't just work on prevention either. I mean, we need, if we're going to do reform work, we need to be thinking about, I would say there's 3 broad frames of reference. There's those people that are in crisis for whom prevention is simply a matter of stopping a bad situation getting worse. And then there are those people that are wobbling, that could go either way. Now the system wobbles them into crisis. But I'm talking, we did some work a few years ago around people that owed us council tax. And we know that the emergence of a council tax debt is actually quite a good signal that someone's starting to wobble. And if we treat that as a signal rather than as an excuse to write to somebody and threaten them with a bailiff, we can actually work preventatively. So there's the wobblers, and then there's the people that aren't wobbling. But if you think of Michael Marmot's work, you know, people that are in a situation that is more likely to predispose chaos. And what do we do in those areas around the determinants of health and well-being that lowers the likelihood of that occurring? So I think working across the wobblers, the predeterminants and the crisis in a way that's honest about what it is we're up against right now, it means we stand a chance, but we can't do it for free. We do need some resource for reform that belongs to everybody and nobody. Sorry, that was a bit of a rant, but it's been a long journey getting all this stuff together.
Thanks, Mark. Fascinating. Brilliant.
Nick.
Hi, Mark. I work over in Health Commission in North Cumbria, and I don't think this is really a question. This is more me expressing how desperate I am for this to work, and for you to make a success of it. I think everything you've said is kind of, it's what the system professes that it wants to do, in that putting the person first, and what the system never does is put the person first. The system always works within the constraints of its staffing levels, of its finance, and the fact that local government and NHS are essentially set up to fight against each other for resource.
Yeah.
And that is a real issue. And I think your data-driven approach to this is absolutely the way it has to go, because bean counters like to count beans, you know, and if you cannot, there's still so many people out there that if you can't measure it, it hasn't worked. Right. And I think I essentially I'm really jealous that this is happening over there and not over here, is the main thing that I will suppose.
Well, let's talk about that. I mean, I think actually, interesting, you're right. I mean, I talked about stalemate. I think I'm probably under-describing it. It's a fight, isn't it? You know, you talk about the local authorities and the NHS. I mean, I've been in those delayed discharges meetings where, you know, it's essentially a justification and attribution piece, isn't it? And that's worse than a stalemate, really. I think this. I mean, one of the things I'd observe about commissioning, and I haven't really laboured it in this presentation, but I think I alluded to it. If we just do this in operations, even if it works, it's not enough. There needs to be a liberated approach to leadership, a liberated approach in particular to commissioning. So commissioning, imagine if we commissioned for learning. Imagine if commissioning was asking different questions, not a preemptive description of what good looks like, which people are paid against. You know, I mean, we've had people say to us, we're the commission provider, so you can't do that because, you know, that's not part of the spec. But that's immediately constrains method, and we can't absorb variety. So commissioning is in and of itself, no matter how diligently the spec is put together, the fact that it's the spec is a problem. So if you commissioned for principles and rules and learning and purpose, so purpose-based commissioning, and there was much more interplay in terms of how what's actually happening and iterating. So commission for iteration. Imagine saying, we're going to commission you to get better at this through this method, and we need to show us how you use data to learn and improve, as opposed to these are the metrics, I'm not interested in any of the others. So there's something about how we might think differently about commissioning and leadership and governance, as well as operations. Because what we've learned is that doing the liberated method in operations immediately butts up against those things. So it makes it unsustainable. Even so, I've just written an article, actually, published it yesterday. I've co-authored it with Professor Hannah Hesselgreaves from the Newcastle Business School, and its subtitle, or one of the headings, is "It's not enough to be right." As I think it plays in this idea that you can have all the data in the world, but we need to think differently about some of those things. So I hear you, Nicholas. I do think there is something about creating curiosity and starting this in lots of different places. It doesn't need big funds. I think my maxim is start somewhere and go everywhere. So if people want to talk, if people are curious and want to set something up that sets this off, more than happy to talk to people about how to do that, because we started quite small and we just went for it.
Great, thank you. No, it is. It's quite inspiring, to be honest. It's that when you talk about variety, it makes me think about the viable system models and that sort of thing around how
Meadows and things like that.
Yeah, so systems fail when they're not able to absorb the variety that's thrown at them, and I think we're set up to fail because we're too constricted by our metrics, by our targets, and we cannot adapt to what people need, and that's what we need to do.
I mean, Donella Meadows was writing about that in the 70s, possibly even the 60s. This stuff is not new. It's just, for some reason, we've lost our way, I think, and I think austerity has a role in that. And that's not a political thing. That's a fact, insofar as it drives a focus on efficiency, and it takes you away from your purpose. Doesn't matter what political colour you are. That's true. So it's something that we can. There is definitely. I think we've got most of the resources we need. We've just diverted so much of it into checking eligibility, all sorts of infrastructural stuff that essentially is chasing this efficiency dream, and it doesn't work. So you definitely got work to do there for sure.
Penny.
Hi, Mark. Thanks for the talk this morning. It's lovely to come out of a shell and see what's going on elsewhere. I work in Sunderland in a collaboration of health and social care commissions providers, our local collaboration Altogether Better, and mainly around older people's services. I'm interested about the knock, if this has had any knock on to the other teams in adult social care in Gateshead in terms of approaches, because like you say, it's all the bits are there. It's the approach and the way you approach things. So I'm just interested on if it's influencing other teams in the council.
We've had mixed responses. So there are people in what's called the asset team. I don't know if you have much to do with the asset team, who are essentially an adult social care team that are trying to work slightly upstream of the eligibility criteria. So they love it. I mean, it's very conducive to what they're trying to do. But I would say they're working. If the eligibility criteria is 12 o'clock, they're sort of at 10 to 12. So they're getting a bit upstream of it, and they are trying to sort of manage the pipeline. But the pipeline is already there. But they're really keen, and they're trying to understand a bit more about that. Where it's less problematic, where it's more problematic, is around the interplay between the social care system and the mental health system, where you've got commission services and social workers that I think feel very, and I understand this, I really do understand it. There's a defensiveness because they've been painted into a corner around the options at their disposal. So the weapon of choice is a care package generally, and actually, if you're doing something that's more nuanced, it kind of undermines that method, and what a lot of people will feel is that it's undermining their professionalism, and that's not our intention. So some people we've said, look, we get that you're constrained, but maybe if you worked with us, we can work out how to actually break that and to liberate it a bit, whilst not breaking the law or doing any harm. And others are saying, well, hang on, that's an existential threat to me, so I don't like it. And we're getting a bit of adverse reaction. But what we find is that it changes. So as we work with people that they know, and perhaps it hasn't worked and it starts to mellow, we're very anxious to avoid an us and them. And we kind of we create what we call learning loops. And we'll take those people through a learning loop that helps them to sort of normatively understand why it's different and what they can do to perhaps change practice or to experiment. Because if they do experimentation in the same principles, they'll teach us a bunch of things that we didn't know. So it's having mixed results, I would say, in terms of the influence on other teams. Even though we get our hit rate in terms of improved outcomes for people is in the 90% plus. You know, sadly 2 people have died that we've been working with because that's just the nature of the cohort that we're working with. And with 1 person who's not engaging, and we haven't closed the case, we don't close cases, but the rest are moving forward. And I think that's creating enough curiosity for people that are struggling to keep coming back. So early days, Penny, I think we've got another 2 years to run, and I'm hoping that we can change that relationship with the teams that are sceptical. But I get that it's coming from a vulnerability, and I understand that vulnerability because they didn't create it. They've been essentially painted into a corner. So we're trying to be compassionate because we've got license that they don't have. So we'll get there.
Thank you.
Claire.
Hi, Mark.
Hi.
Really, really interesting presentation. I work in North Cumbria, like Nick, and the voice of the third sector within our kind of integrated approach. I'm really interested. You were talking about case studies, case workers.
Yes.
Being people with lived experience,
yeah.
and how and where you draw those workers from, and what your connections with the third sector, and are the third sector a good space to kind of position those caseworkers?
I think that's where they should be, but I don't think that's just where they should be. I think essentially this is how the whole shooting match. I think every sort of substantive service needs to have the capability to do this work alongside its specialism, but I think it also would be amazing for this to happen in the third sector. So we're working extremely closely with the third sector. So our caseworkers there are 2 roles, and they're paid the same. So the community caseworkers tend to have a professional background, and they come from lots of different sources. We've got a probation officer, we've got a CPN, we've got benefits expert, housing officers, drug and alcohol worker. We've said to them, leave your lanyard at the door, but bring your skills with you. So we've got half of them are caseworkers. The other half are peer support workers, and they all have lived experience. They're paid the same as the caseworkers, and we appoint those through. So a lot of people are in recovery, but we make sure they're a long way into their recovery journey because we don't usually traumatize. So we have people in the program that themselves are in recovery that are absolute experts in this. I'm not. I understand it's important. I don't have that kind of lived experience. And what we find is that we are the people that are attracted to this are working with other third sector providers, and we've worked just in the course, not working, but being helped by and contributing to the work of third sector providers. And what we're finding is when we're recruiting, we make it clear in those spaces that this is what we're looking for, and the recruitment process is completely different for them. So what we won't do is the usual, just little things like, we would love to speak to you. If you need to bring somebody with you just to help you settle, that's fine. we're not going to say put a claim form in for your travel expenses. We'll get you here. Yeah, just these little things that are big things for people that are skinned, because a lot of people are skinned. And again, I'm probably underselling it because the people that are really focused on that are not me. But we're finding that we're pulling people in from all sorts of different backgrounds, that with different types of lived experience. What's really interesting about the way we're now evolving the practice is that for the people that are in real chaos, we're actually doubling up. So we're having a caseworker and a peer support worker, both with will both be caseworking with a client, and they'll have more than one client, but essentially you get that interplay of those two roles. We're finding it's extremely effective. And what we don't do is we don't say to the peer support worker, you need to make it clear from the off you have lived experience. It's up to them when and if they disclose that. It's totally up to them. But actually what we find is that as we're building that trust and a relationship with people, the person with the lived experience is just able to work on those nuances around. Don't bring him to this building, because I know that when I was in that state and I came to buildings like this is how I felt. Why don't we suggest doing this, and why don't we give them the agency to decide? And all these things that are really subtle are amazing. And what that's teaching us, Claire, amongst a bunch of things, is that most of the settings where we have these really important conversations are nowhere near council building. They're nowhere near the NHS. And I know that sounds really obvious. That's not how we roll, is it? Normally, we come into here, and the peer support workers have been brilliant at creating these sorts of spaces for people to actually start talking about what matters, and then we can do the liberated method. So my take on that is that if voluntary sector organisations had people that were doing this as well, alongside whatever else that they want to do, it's to them, of course, not to us, then surely we're building a collective capability across this ecosystem of health and well-being, and I would love that. So that's a really sort of long-winded way of saying, yeah, but there's so much more to it than that, and I'm really proud of the fact that we've got some brilliant voluntary sector partners, Two-Way Tenancy and Rococo, and we're working with the drug and alcohol team as well, who I know they're commissioned. And we've done some work with Edbert's House in the past. And I mean, I'm probably doing others a disservice, I can't recall them, but there's plenty of interplay. And Handcrafted have been amazing. Yeah, there's some really fantastic partnerships building, so I'm really pleased with that.
Brilliant. Thank you so much, Mark. I'm conscious of time. We've just gone past 11 o'clock. I think we could talk about this for hours. It's just absolutely fascinating. There are some questions in the chat, Mark, so I don't know whether you mind afterwards just having a look through those and seeing it. If you could just respond to those, that would be great. But thank you so much, everybody, for attending. Again, just a reminder, I will pop the link to be able to give feedback in the chat. We have obviously recorded this session, so we will be popping it up on the YouTube channel as well. So you can feel free to share that once that's uploaded. So once again, thank you so much, Mark, for coming, and I hope everybody enjoys the rest of their afternoon. Take care, everybody.